The School of Medicine at the University of Nottingham offers a graduate entry medicine course. Students work within an ethos of evidence-based medicine, which is led by a very practical approach.
Is that if in clinic it is 140/90?
Dr. John Frayne is Director of Clinical Skills.
What we've done here at the University of Nottingham is encourage the students to identify a patient that they've seen on their primary care attachments, who has been particularly interesting and in whom they may have seen a clinical sign. And then, having identified a clinical sign, we ask them to go away and try and retrieve the evidence for that clinical sign and appraise it and then reflect on it.
Students write an assessed essay on this work, but that's not the end of it.
Having done the summative component of the essay and received their mark and received their feedback, we ask them to then further reflect and prepare a short presentation which they can share within their clinical skills tutor groups under the tutelage of their usual facilitator.
Mr. B was very happy he didn't have to take any medicine. He really didn't want to have any medication. And he could indulge a little bit longer in his favourite, chips with salt and vinegar. He could really do that. But it made me wonder whether he has been subjected to needless testing. Yes, it wasn't invasive. One of the lovely feedback that I got on my essay, and it was absolutely accurate, was that I was so enamored of the wonderful yeses that came out of the reference search in the reference test that I didn't probe him further. So that's the question though. As a medical student, we don't have much time. As doctors, they have even less time. Don't know. So, what are your questions for me?
My question would be, having studied the evidence, if a medical student or a doctor said to you, should I use the radial pulse or the brachial pulse as my pre-systolic assessment, which would you recommend and why?
I would say that there are two schools of thought, and then I will tell them which one I prefer. First school of thought would say that the radial does not...
If there's so much evidence for the home machine testing, why it is that we're still measuring blood pressure manually if the results are more reliable with a machine? Did you find that out?
I did. When I was trying to understand why it is a reference test, it looked like it was from the days...
I think it gives them an opportunity to present material that they've prepared themselves and to practice communicating quite complex medical ideas and statistical ideas to their peers, and then also to test their understanding of the material by answering questions on it, and then more widely just to share their experience of doing the piece of work and what they've learnt about evidence-based medicine more widely. And then there's just the kind of interest aspect of it, that students find it interesting, having done a piece of work themselves, just to hear what other people have done.